here because there's are plenty. This is the blood supply diagram of the kidney. It's interesting to notice that particular info that you see over here. The kidney received 21% of that cardiac output. This is a huge amount of blood. This is the reason why the heart and the kidney have that beautiful intimate relationship in the way how they control the blood pressure. As you see over there, you have the renal artery and you have over there the veins over there too. The renal artery, just something that we will see later, is an artery that is in high risk of weakness and can create aneurysm over there. Meaning that when we check the heart and the heart don't have any kind of problem, why you have a high blood pressure? Well, we need to check those arteries and we need to check the kidney in general because probably the reasons of your high blood pressure is because your kidney. Okay? That is the first thing that I would tell you over there. In medicine, like in other areas of science, that route of the blood need to know by you at all costs. Obviously, so you didn't learn this one in anatomy and physiology, be careful because you will see that route of blood again, and it's important for me that you know that. Now, jumping to the next one, you have the two kinds of nephrons that you see over there. You have the cortical nephron over here, and you have the juxtamedullary nephron over there. As you see over there, even that the kidney, especially the nephron, make the filtrations of all that blood in that glomerula that you see over here, most of that substance sometimes need to return back to the blood. And with this particular presentation, what I want to give you is an idea how the nephron looks from the cortex perspective, that is the one that you have above, and the juxtaglomerula that is huge, have a huge nephron loop that goes all the way inside, so that medulla. Now, let's go to the renal corpuscle. Let's go to this area, to that capsule that you see over there. Voila. As you see over here, this is the renal corpuscle. You see over here the afferent arteriole. That is the blood that is coming out from the, obviously, from the aorta, from the heart, all the way from the renal artery until reach to this tiny afferent arteriole that will feed the beautiful capsule over there. The capsule is like a filter. Everything that is a waste, everything that don't need to be in the body will pass to the next step. The next step is this area that is called PCT, proximal convolute tuberous over there. The problem over here is that sometimes substances that are important for you also goes in that's the first step of filtration. Sometimes glucose can pass, vitamins, minerals of any kind, hormones that your body still needs. Some substances that are so small, they can pass the first filter inside of that area over there. It's clear? Now, this area is very important too for the perspective of control of blood pressure. I told you in class several times that there is only two organs in the body that are capable to control their own blood pressure. The brain is one and the kidney is the other. The kidney can do that, especially at this level. How they do that? Very simple. If the kidney sense there is huge amounts of blood reaching to him because there is huge amounts of blood pressure to this afferent arteriole, this afferent arteriole constrict, basically shut down, close the walls over there, and allowed huge amounts of blood reaching the glomerula. The glomerula is very sensitive. When we said that we find out cast in the urine means that cells that compose that glomerula over there became damaged travels all the ways in the tubulus over there until they reach the bladder. Meaning when we say cas, or we will say something that belongs to the glomerula, we already have an infection in front of us at this level, and that is a pyelonephrosis over there that we need to address right away. Now, as I said before, if we have high blood pressure, the artery is closed over here, keeping a constant blood pressure inside of the glomerula. But what happens if for some reason you have a problem in your heart and the kidney need to receive a constant blood pressure to do his filtration? Because that is the other problem that could happen, that the blood pressure goes too low, that is impossible for the glomerula to continue their filtration. Well, the kidney have another way how to deal with this. And what they do, they close the exit. When they close the exit, the blood that is reaching over here start to increase in huge amounts and increase in huge amounts of pressure. That is what will keep the pressure going for the filtrations of that blood. Again, if there is a lot of blood pressure, they close the afferent to protect himself. If there is a low blood pressure because there is a hemorrhage or because the heart is weak, then I will shut down this one and obviously dilating this one a little bit more, but closing this one to keep the backup of blood over here that will keep my pressure steady to continue with my filtration. That is what happens over here. All right. With that explanation, let's see now the overview of the entire nephron. This is how the nephron looks. I already discussed to you this area over here. All the nephrons are surrounded. I will jump immediately to another picture, then I will return to this one. All the nephrons are surrounded by those capillaries over there. All those tiny capillaries are very important because if there is some substance that basically pass the glomerula, I need to reabsorb them back to the blood. The nephron, as you see over here, have an important what? Structures and steps over here. You have the PCT, you have the famous loop over here, you have the DCT, you have the collecting duct. Normally, we consider a nephron from the moment that reach the glomerula until reach the DCT. Okay? Now, most of the diuretics that we use in medicine work in this area, in the loop. Why in the loop? You can see that for yourselves. The loop is very thin, and because it's very thin, allow the passage of these areas over here, that is the ascending in one side and the descending in the other side, are very thick cells and are impermeable for water, meaning the water cannot pass in that area. The only way that the water can move back and forward is just in that loop. Meaning that when I give a diuretic somebody, if this is the area that he makes his work possible. Okay? A lot of water will come from there. Obviously, the kidney have a beautiful system, especially the nephron, to know how much urine need to go over here, how much water they need to go over there, how much electrolyte I can let it go. Why? Because the kidney can sense constantly what happens in the blood, and he encounters there is not a huge amounts of water here in the blood, immediately in other areas of the DCT, using ATP, he will drag water from that urine contained back to your body. Meaning that, believe it or not, the kidney is still capable, even that they pass for the entire system, to still regulate the amounts of substance that can expel inside of those collecting ducts. This is very important because remember, the finalities of the kidney is not create water. the finality of the kidney is to preserve water. He needs to let water go, but he will try to do so in a small amount until you start to drink water back again. Okay? And you see over here, this is basically a rapid view how the nephron works over here. I use you see over here, let me move this one out. Amazon delivered my package. You see over here, sometimes we need water because we didn't drink huge amounts of water during the day. The kidney will react this way, especially the nephron. They will return that water back to those arteries. This is extremely important because that is how the kidney will keep your homeostasis, will keep your beautiful volume of fluid constantly, and that is the reason that your blood pressure don't supposed to change too much in response to volume changes, because the kidney will keep steady the amounts of fluid running through your vessels. Now, exactly what I told you, the kidney need to keep an interesting pressure constantly. That is the pressure that they need to keep constantly over there. If anything damage that balance, many substances that are in your blood will pass inside of the urine. Clear? Yeah, I will leave it over there because then something more interesting will happen, but I want to make sure that everybody understands this part. Now, this is how the kidneys knows what happens in the blood and what the kidney can do to basically reabsorb those nutrients, those water, those elements that are in the probable urine that I cannot let it go because I need them back. Meaning that the kidneys is constantly in connection, especially the nephron and the capsule, with this nephron loop and with those contains inside of these areas. Again, if I need something, I will pull it back. I will never let it go inside of the urine. And that is the reason why that the nephron is an interesting machine from the perspective of medicine. Many things can damage a human body if if everything goes out with the kidneys, meaning that we need to be very important, pay attention with this patient when they have some kind of kidney infection or diabetes that is already affecting the kidneys. Let me see if I can show you something more. It's very interesting that most of the transportation of the substance back to the blood from inside of the nephron, from inside of the loop, from inside of the PCT and DCT is because you have these tiny transporters that are amazing. They consume huge amounts of ATP. There is a statistic over there that says that almost like a 40% or 21% of the calories in your daily life is to keep the nephrons, uh, basically proteins, working in the productions of ATP and making that transportation possible. This is the last one that I will show you over here because it's important for the perspective of diabetes. One of the things that I mentioned in some of the classes is that in a diabetic person, when the glucose levels start to increase in blood because the lack of insulin and situations similar to that, the accumulations of that glucose inside of the tubulus is humongous. But glucose is food. You don't supposed to waste food. But the problem is that the nephron don't have the capacity to reabsorb all that glucose back to the blood because all the available transporters are busy. And that is the situation that the glucose goes in the urine. And what is the number in glucose when something like this will happen? You have it over there, 220. Why I make this observation of 220? Because it's at that level of glucose in your blood that the glucose will start to show up in your urine. If that happens, what will follow is the next thing. Glucose will work like sodium. He will drag huge amount of water. And if you let that patient make pee or glucose, they will start to lose huge amounts of water. And you have a person that is completely dehydrated over there. And that is the risk to have that glucose levels too high. Obviously, if the glucose levels continue increasing because there is no insulin to break down and allow the glucose to be absorbed for the cells of the body will start to use another source of food that is the fat. And the fat, exactly what I mentioned in one of the classes, start to produce waste. The waste that the fat produce in the metabolism is ketone bodies, and that is the reason that you have ketoacidosis in the diabetics. All of the things that you saw over here, especially this information, we will see it in the class. The problem is we don't have all these particular pictures that help out to explain a little bit how this is going on inside of the kidney. Okay? With that in mind, this is the explanation that I want to give with the perspective of the nephron. I will go back now to chapter 28. That I will help you out to understand and give you a little bit of background about what I will discuss now. Acute kidney injury, and we are starting chapter 28. We already in science, in medicine, the way that we call the thing I always like to change. In my old days, we call this acute kidney failure, but now they want to be more refined, and it's acute kidney injury, vogue. But for me, the same thing. Broad spectrums of kidney diseases ranging from minor changes in the renal function to complete renal failure that we need to require what? A renal replacement therapy that could be dialysis or kidney transplant. I will not ask you anything there. This one, pay attention. Sudden reductions of the kidney function causing that is an interesting multiple choice. I always need to ask for that in several ways. I did it with the other question, but there is a question specifically from this one. The next question that everybody will see is this one. I will say yes, 404. This is an important classification system that basically measures the level of the acute kidney injury, and it's called RIFLE, risk of injury, injury failure, loss of function, and stage kidney disease. Very important, that final line also, because explain what this means. The first three ones over here means severity of the kidney injury, and the last two means that you basically represent the last two represent the patient outcomes over there. Meaning, careful with this one. I will ask you exactly like that. The theology and pathophysiology, I will not go with this one. The three sides of the disruption, careful with this one, especially the first bullet. 104 is multiple choice. This one also have a multiple choice, but this one is 104. That is the question that make the things a little bit different between themselves. This one is a freebie. It's a true or false question. This one is 204. Believe it or not, somebody is asking me if the session is over at this moment. I don't know where she is. He's asking me if we are online at 8:22 of the night. Yes, Fernandez. I hope that she hear the recording and I am talking about her. Yes, Fernandez, you are late. Okay, moving on over here. This is a multiple choice. See over here the Bowman capsule that I showed you from the other slide? That's what I'm talking about. Because the obstruction within the urinary collecting system distal to the kidney, there is an elevation of the pressures in the Bowman capsule that don't allow the filtration inside of the PCT. Meaning, if you want to have more sense about what you are reading over here, you can go back and watch this video to make reference to those particular pictures that I show you out. There is plenty of them in YouTube also about the filtration in the glomerula that can help you out to understand better. I just went a very big highlight to give you more sense about what we are talking about. Again, careful with this one, multiple choice, 104. How many versions of one? This one. This one is just one. The intrinsic intrarenal kidney injury is another question, 104. I love this question because the student, for some reason, forget what is intrinsic from pre-renal and post-renal. Everything that is before the kidney is pre-renal. Everything that happens inside of the kidney is exactly like that, intrinsic intrarenal. Everything that happens in the ureterus all the way to the bladder and continues is post-renal. If you remember that, you cannot mistakenly make the wrong answer. But for some reason, they mess up that an obstruction in the bladder is because something over there pre-renal. How is possible that? I don't know. Meaning, make sense about the question first before you jump to answer. Again, 104. This is part of the previous one. Careful with this one. See over here what I told you about the tubular inflammation, the cast that you will see over there, all the things that belong to that nephron that start to become damaged and detached from those tubulus will show up in the urine. And that is what will give me the indication that something is going on in the nephron and is an intrarenal problem. Again, this is part of the previous one. Forget about that. This is the I will say the presentation for what I will ask. I will not ask you anything from this one. Prodromal phase is a multiple choice, 2 or 4. You will see this question. Normal or declining urine output, serum of the bone. I hope that you know what is bone. If you don't know, it will be a good assignment for you to know for that because you're supposed to know that. Careful with that. Multiple choice, 2 or 4. The oliguria phase is another question, 2 or 4, very important for me. You need to know that. The only question that is only showing once is this one, 1 of 4, multiple choice. Obviously, all this particular damage that the kidney receive will make the kidney enter to the next step, chronic kidney disease. An acute injury that repeats itself several times can push the kidney in this condition. Out. Well, the 15 is a multiple choice. I say it. 2 or 4. I saw that was the 16 because 16, exactly, it's out. This is a question. Now, this one, 1 or 4. But exactly what I said, a kidney that is submitted himself to acute damage constantly will enter in the next stage. And that is bad news because we have a deterioration in the kidney that will continue like the insurance progressive. And that progressive will never stop until you don't have kidneys anymore. Meaning, what we need to avoid that is that the kidney enters in that direction. That is what we are looking over here. Because once that it happens, sooner or later we enter in the end stage renal disease, and is when we need to use dialysis no matter what. Okay? Now, I will not ask you nothing from this one, but the previous one was a question. Now, chronic kidney disease, there is a question from this one. Careful with this one. There is a true or false question. It's just 1 of 4. I like to trick you out with that one. I did a new question regarding with this one, the risk. That is the newbie. This is 104. This one I didn't make anything as a question, but it's interesting to notice this, that the kidneys is capable to continue doing his job until 25% of the neurons, meaning 75 or 80% of the neurons are gone, the kidney can still doing his work. But obviously, a kidney that is only 25% of nephron working, I don't need to tell you that sooner or later they will enter in the end stage renal disease, and sooner or later will use dialysis. But it gives you an idea how strong is the kidney to continue his work, even that the damage is very gross and very big in size of that kidney. Again, I will not ask you anything from this one. But this one, yes, this is a multiple choice. 204. Then I did an interesting question that will engulf 3 slides. Hear me well, hear me well, hear me well. I have a questions, multiple choice, about the complications of the chronic kidney disease. What I did, I said, all of the followings are complications of the kidney disease except hypervascular hypertension, uremic syndrome, metabolic acidosis, and then I will go to the next one. Electrolyte imbalance, bone mineral disorders, malnutrition, anemia, pain, depression. Meaning, same question for 2 tests, but because I have several options over here between those 2 tests, the question or the option, there is some tiny variance over there, but it's the same question for the both tests. Complications of the kidney disease, except, meaning that for the people that are losing time, 24, just the bullets, the main bullets, the main bullets, 25, main bullet, and 26, bullet, 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 bullet. It's very similar to the first slide that I showed you over there. 22, no. 204, that is correct. Now, acute kidney injury, the main important thing is prevention, but I didn't ask you this one over there. Avoid contra medical. Forget about that. You will go with this one when you reach over there to your beautiful core. Kidney disease complex require multidisciplinary approach. You will see that when you enter to the clinic. That's why I didn't ask you for this one. The same thing with this one because it's more management. And then we'll start to talk about the different advices how to keep the kidney healthy. But because I cover with the complications of the kidneys what I want to ask, that's why I cannot ask you anything from these ones. Now, just to review something that we learned from the cardiovascular system, the goal in these particular persons is to keep the blood pressure below 130/80. Good luck, because you remember that the new guideline says that now need to be need of 1/80, meaning 120/80, meaning that normal blood pressure will be 1/10/70. In a person that has been with high blood pressure in their entire life, try to reach 110/70 is to ask for Santa Claus a beautiful Mercedes completely full equipped the night before Christmas. So yeah. Moving on over there. Again, I'm not asking you anything. Also, I will not ask you anything about this one. Remember that your body keep a constant control in the pH, because if the kidney cannot remove the hydrogen ions, that is the only system that they can do that in the urine, you already know that that pH will go down. And you already know what happens when the pH goes down. The enzymes start to become freaky, and the productions of the ATP can decline, and organs that are very sensitive to the lack of productions of ATP and the pH low start to become damaged. Again, I will not go with this. This is an area that is very sensitive for the nurses to be, because you need to understand those values very closely over there in critical patient. But you already have a lot in the dish. I want to at least to give you an idea what you need to deal with. Yes, it's very Candy Crush indeed. Again, chronic kidney disease, you will have a problem with PTH and calcium, obviously, because who produces the vitamin D? Obviously, the kidney. Capisci? And basically, if you don't have kidney, who produce vitamin D, how you will absorb sodium, you already know what happened next. Again, I didn't ask you this one. The same thing happens with malnutrition. I will not ask you for that. Everybody needs to be an expert at this moment why a person with kidney problem is anemic. And if you didn't get it after almost 6 weeks in this class, remember what happened when we don't produce erythropoietin. Yeah, I will say it again because the people like the way that I say it. Erythropoietin, 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 erythropoietin. And that way you will remember my name the rest of the night. Moving on over here. Pain. You already know that person that suffer these kinds of situations suffer a lot of pain, but I will not go with that. Depression, believe it or not, nothing, 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 nothing until here, and nothing, because I already mentioned in the first one in the complication, pay attention. If I ask you the questions of the complication, that's why I will not ask you this one, because there's already engulfed in that question. Of course, until you see the quiz. Then the famous dialysis, remember, this is something that I didn't ask you, but some of you we will see in the hospital, especially when they reach in that stage 5, and that questions of the stages that we saw before. I will ask you for those stages, meaning careful with that one. I will remove it away, hemodialysis, okay? In these days, there is many advantage right now. I hear some news from the Undertaker, a friend of mine that is very savvy in these particular things that are working in some lab settings, and he's telling me that there is an artificial kidney, very interesting thing that they are putting over there. It's a semi-robotic kidney, and they are making some particular testing of that. Let's cross the finger to see what happens in another 20 years, because I'm pretty sure that most of the things that we see in these days that probably will be science fiction in another 20 will be a reality, like a smartphone. Let's move on over here. Very interesting. This is a way how to do dialysis, and it's through your beautiful peritoneum. It's basically I put a catheter inside of the epiplome. Remember that you have above or anterior to your intestine a layer of fat. When I put a catheter through your abdomen, I put huge amounts of clear water. That epiplome, that layer of fat, will serve like as a filter. And the water, because it's pure, crystal clear, basically will absorb all the waste through that fat. After a couple of hours of that water inside of your body, I subtract the water out, and you basically did a peritoneal dialysis. The problem with these particular things is that don't work more than 3 times of use, meaning that if we don't have a kidney by the time that we are doing this particular dialysis, you know what will happen next to that patient. But again, nothing over here. Transplantation, obviously, I didn't ask you anything about this one either, but that's the best option for the patient that have end-stage renal disease. The problem in this is because the risk of that particular patient that basically form rejection to the organs. I have situations in when the person receive a kidney, everything goes fine the first few months, and suddenly enter a fulminant rejections of the kidney and basically goes back to the step one in dialysis again. Why? We never know. There is many things still that even that was the same kind of compatibility with the host, something could happen that create the rejection in the long run. But I will not ask you this one. And believe it or not, this is the last one of the chapter. Yeah, believe it or not, I did ask you this one over here. Meaning, this is a beautiful way to summarize the most important thing that I want from these two chapters, but you have a beautiful background over there. Yeah, we'll stop the recording of chapter 22 and we'll start to chapter 29 soon. Let's